Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest introduced to you now. Dr. Eric Rodgers is a practicing optometrist at Triangle Visions Optometry. After owning practices in Raleigh and Hillsborough, he joined Triangle Visions in 2015, where he practices full scope optometry, treating eye disease and fitting all types of contact lenses. He received his undergraduate degree from the University of North Carolina at Chapel Hill in 1982 with a degree in chemistry. He received his Doctor of Optometry degree in 1986 from the Pennsylvania College of Optometry, which is now known as Salus University, completing optometry residencies at the VA Hospital in Huntington, West Virginia, and Southern Eye Associates in Greensboro. You can currently find him on Twitter at Dr. Eric Rodgers. Dr. Eric Rodgers, what an absolute honor it is to welcome you to Boundless Body Radio.
Thank you for having me on, Casey. I really appreciate it.
Yeah, of course, man. It's such an honor to host you on the show. You and I have run into each other several times at different conferences, and you and I were just speaking, a little bit offline about that experience. And for as much as we love the presentations and love seeing, all the latest research and stuff that's out there, isn't it just so fun to connect with all the people in our community?
Absolutely. It feels isolated when you're in your own community where there's not a lot of face to face. So I
Yeah.
really look forward to those meetings.
Yeah, it really can feel isolating. I think that's a really good point. And it seems like every year at different conferences, we find new people from all over the world who are finding some of this stuff and having them also, come together with us and get new ideas and all kinds of stuff. It's the best part of the conferences that you and I get to go to.
Absolutely.
I also wanted to ask you about an experience that you had last year with the metabolic revolution and the day that you guys spent in Washington, D.C. It's been a year now, so quite a bit of time has passed. But can you tell us a little bit about what that experience was like?
Oh, sure. That was one very memorable. Jess Apple organized along with some other people and the leaders in the group. And we had a day on the next to the Washington Mall and got up and made presentations. Several prominent speakers spoke and just tried to get the message out there.
Jess Apple is an absolute wonderful person, isn't she?
Absolutely. And I got to meet Dr. Lustig. First time I saw him, got to meet Vinnie Tortorich. First time I saw him in person. And so Dr. Tro was there. It was really, and Dr. Westman was there. It was quite a list of people that came.
That's awesome.
Yeah,
Wow.
and it shows how passionate they are. Everybody in this space is just, trying to help raise awareness. I spoke to someone today who's a recent graduate of medical school, and I just said, okay, how many primary care doctors are familiar with insulin resistance? What percentage do you think he would say?
Oh man, are you asking me?
I'm asking you.
Oh gosh. I mean, I'll
I
be
was
generous.
guessing low, but I wouldn't have gone this low.
Yeah, I would be generous and say 10%.
Yeah, three. Said three.
Wow. Jeez.
But that's just a guess. But that's just striking because Gerald Reven, is in the late 70s.
Wow.
I mean, that's been a while
Yeah,
since
that's
this,
incredible.
and it's just so anyway.
And
Yeah,
well,
that's
and
one.
and the context of like 93% of Americans
Mm,
are shown to
mm.
have some form of insulin resistance, and yet only 3% of doctors have even been taught anything about it.
Exactly. My fear is they just watch glucose, and as long as that, and of course they might say lose some weight, but they just watch glucose, and that stays in line long far down the road of insulin resistance. And then it's 10 years, 12 years later, then the glucose goes up. Then they say, oh, you have a problem. And even then they say pre-diabetes. That I'm not happy with that. It's not pre-diabetes, it's diabetes.
It's so sad. Yeah,
Yeah.
and you and I sit and laugh, and it's so ridiculous to us, and
Mhm.
yet it's just affecting so many people.
Yeah,
So,
yeah,
yeah,
yeah.
thank you for sharing that. That's amazing. And yeah, do you know whether the COSI presentations are made public? The Dave Feldman show are those presentations
I
public?
believe only few of last year's were made public, but I'm believe I've heard there are more will be released from
Okay.
last year's conference.
Okay, well, for people listening or for people watching, I'll go do a Google search and I'll see if I can find Jess Apple's presentation from the 2024
Oh
COSI
yeah,
presentation, which you were present for. And
awesome.
oh my gosh, that was an amazing
Yeah,
presentation, wasn't it?
absolutely,
Yeah.
absolutely. It was. Yeah, it was stunning.
Yeah, flew literally halfway around the world to
Yeah,
be able to give
yeah,
that talk, and
yeah.
just blew everybody away.
Passionate. Just
Yeah,
yeah.
well, thank you for sharing that. I like love that, and you also have a really tremendous story of getting into healthcare, thinking you were doing some healthy things. So if you don't mind, can you share a little bit about your story with health, and how you grew up, how you got interested in medicine, and how your health journey went?
Sure. So I'll just start near the beginning. By the time I was in grade school, by the time I was in third grade, I was overweight and I was confused, I guess, because not many people were overweight in the mid 60s at that age. Now it wouldn't be that unusual. So anyway, I go through middle school overweight, and then when I hit the growth spurt, it started evening out because I got to be about 6'1.5", and that helped. But then heading off to college, still overweight, and I did not want to go to college that way. But also, I'm not sure if my blood pressure had already gone up by then. It may have. But anyway, okay, here we are going off to UNC. And I'm just like, I don't want to go to there overweight. So what am I going to do? And so what I did is so random. I just said, I'm only going to eat 3 times a day. That's the only thing I knew. I always heard that. So that's all I did. No snacking, 3 times a day eating, but it was still junk, but 3 times a day. And I lost a fair bit of weight. And that helped. And there I go to Carolina, do fine there. Then I go to optometry school, do fine. But by then I'm on high blood pressure medicine. By then I'm starting to try to exercise to counter the weight problem, which was only probably 20 pounds overweight. But I had metabolic syndrome looking back because I had high blood pressure and my triglycerides were going up and my waist was going up. And so, all right, now you're out of optometry school. On blood pressure medicines, and I got on Lipitor probably when it was invented, unfortunately. Okay, so we'll just fast forward to when I was 40 or 45 is when depression first hit. And prior to that, all the metabolic problems were just blood pressure, high triglyceride, metabolic syndrome. Maybe they should add depression as a marker of metabolic syndrome. So I had those other markers. I was on blood pressure medicine, on cholesterol medicine, and then age 45, I go on antidepressants. And the first one made me worse, dramatically worse. And my doctor sent me to a psychiatrist. He switched me, and that one helped. But that started a journey from age 45 to age 55 on antidepressants for 10 years. During those 10 years, there were 3 cycles that were really deep depression. And I started Googling, researching medicine at that point. And by the time I was coming out of my second one, I read each successive episode of severe major depression within depression is going to be worse than the previous one. And I'm like, oh boy, third one, that won't be good. And a few years later, still on the antidepressant, there comes the third one. And yes, it was not good. That was 2015. It was horrible. And the doctor, seeing a great doctor, a smart doctor, and talking now with Dr. Palmer years later, he was doing exactly the standard of care. He was doing exactly what should be done in someone presenting the way I was. And that was just keep adding medicines, really, instead of maybe taking one back. If this is not working, stop that one, start this one. That's more modern thinking, I believe, in treating depression. So there I go, 2015, bad year. Thoughts of suicide, 8 months straight without relief. And then sleep disturbance, severe. And so there we go. Now we're at the end of 2015, which was not a good year. And I lose interest in food. And that was weird. And food actually lost some of its taste. And I've talked to Dr. Palmer about this also. And he said, yeah, this is one, some types of depression go with reduced appetite, some go with increased appetite. And so I diverted down the reduced appetite road. And that's November, December, January. And I wrote it down the date in on my calendar. January, I'm walking the dog. I'd lost some weight because I wasn't interested in eating, and I'd actually like I need to stop losing weight. I wasn't underweight. I still had weight to lose, but I'm like I'm losing weight too fast. And I actually went and got Ensure, and I was drinking those. Horrific to think of
Uh,
that now, but it was calories, and everything tasted the same. So I'll get some calories in me. All right. So now I see my primary care doctor in January of 16, and she doesn't know any of this history. She knows the psych meds I'm on, but she looks, oh, you're pre-diabetic. First time I'd heard that. You're pre-diabetic. You should eat less fat and exercise more. The only part of the package I didn't mention, I was running marathons for those 15 years, one marathon a year. It was treatment for my depression, really. I realize that now. But the good thing is, I knew instantly she was half wrong. Could not be more exercise was the answer. Not a chance that was right. So I thought maybe less fat was wrong. And of course, turned out both were wrong. And I went down the diet road, started vegan for 6 months. Got a little better with that, and then found Dr. Palmer and Dr. Eid at a conference in 2017. Met them both in person and went animal-based keto. Got off of all antidepressant medicines 2017, and here it is 2025. No mood issues in all that time, and it's really hard for people that haven't gone through this to understand the transformation. I mean, everybody that goes keto says, "Oh, my brain works a little better," and that's great. I understand that, but it's a little different when your brain is really broken, and then it works better than you remembered since you were 20.
yeah.
So there we
Wow.
go. And the only other piece to put in there is I started following Ivor Cummings, and at one point he said every astronaut, every president is required to get a CAC test. And if it's good enough for them, it's good enough for you. Well, okay, well, I'll go get one. And that was, what year was that? That was 2017. And unfortunately, it was high. So probably at the same time, I had started following Dave Feldman and was learning his work. And so I've been monitoring that, and obviously friends with Dave Feldman at this point, following his work very closely. And yeah, here we are in 2025, and I'm feeling great. I had a little bump with the hip replacement, but otherwise, doing great. So,
Yeah. Absolutely. Well, if you're listening and not watching, I'm looking at a very, very healthy human in his 60s, and I can tell you that
yeah,
meeting you, seeing you in person, you are a very healthy dude.
um,
I want to go back and talk about a few things, if you don't mind.
sure.
How are you?
65, just to clear it up,
There you go,
65.
65. Okay, perfect. um, Depression. It seems like it's such a ubiquitous thing. So many people are experiencing mental health
Mhm.
issues that it's almost like depression, anxiety, the two of them kind of seem to go together.
Sure.
And I think we kind of downplay how serious that
Yeah.
was. What do you think it was that kept you going in some of those dark times? It sounds like
Mhm.
there several moments that could have been jumping off points for you.
What kept me going? Well, I have a family, and I had back then before I sold my practice, I had a practice, I had a family, and the desire to live is strong, even when you're unhappy. And so I was, horribly unhappy. And so what I guess one thing I did was I would kind of push it out forward. I literally circled on the calendar 3 months ahead of time. Okay, we'll circle that date really. Okay, if I feel like I do now there, that'll be it. Just can't
Wow.
go past there. It's really compassionate. It felt like I was not being compassionate to myself by going beyond that date. But those I never no attempts, no suicide attempts. So those dates came and went, and I just kept muddling through. So
Wow.
yeah, the thought of what you leave behind is probably what keeps a lot of people going.
We just hosted. Are you familiar with Christina Cook? She's also on Twitter in
I
Canada.
have, yeah.
Okay,
Mhm.
yeah. So I just interviewed her for the second time, and she told me that Canada is now considering having mental health be part of the program where they do the assisted. I can't remember what the name of it, where they
Yeah,
do
no,
the
I'm
assisted
familiar with this. Yeah.
suicide. And
Wow.
Christina, now that Genevieve, their daughter, 13-year-old daughter, has been able to step away from mental health issues, they've been able to talk and be more open about those things. And she's had Genevieve tell her that Genevieve would have
Oh,
preferred
sure, sure.
taking that route.
Oh,
Um,
please. If yeah,
that's a dark thought.
oh, no, no, there's zero doubt. If there was a drive-through,
Yeah,
drive-through assisted center, yeah, there are days I would have drove through that,
oh,
no question asked.
that's
Because at that point it was like, well, then exactly now, how exactly, and that's that's the worst stage of suicide or ideation. You start to plan, you make plans, and well, I lost a friend to suicide, friend from college, and wish I knew now what I knew then because he could have benefited. But I also wish I'd known this, and I like to say this whenever I can. If someone ever does make an attempt at suicide, they're more likely to make another attempt, and it's more likely to be successful. And
oh,
my
I didn't know that.
did not know that at all. My friend had made two prior attempts with pills only, and I say only. But over the course of 2 years, maybe 3 years, and then the third time, yeah. But see, I didn't know that that was such a red flag.
Wow.
So anyway,
Thank you for sharing that. I was not aware of that either. I wanted to ask you about the running. It sounds like the running
mm,
was helpful, and we've learned that exercise can be just as effective, if not even more effective, than a lot of the medications for mental health. Is that something that you found to be true? I know it's something you mentioned.
absolutely not a question. It would give me something to look forward to, and I would sign up for a marathon, and then you got to plan for it, and so having something you enjoy in the future that you're thinking about now, like vacations, people do that with vacations all the time. It helps with depression. Exercise helps, not a question. When I was at my worst and I could still run 3 miles, during that 3 mile run, when I was at my worst, I would start off like, it's horribly about mid run. I would be like, oh, okay, I can think clearly. It was really dramatic. And then, but that didn't last long. Maybe only lasted till the next morning.
Got
Uh,
it. Well, it's good that you found something helpful. And if you're doing running at that level, you have to know something about nutrition, whether it's
mm,
correct or not. Like you're going to the running store, you're seeing the products that they have at
sure.
running stores
Well,
and
please.
goos and
Yeah,
gels and all that
please,
stuff.
please, though, please. That what you knew about during my era of marathon running, what you knew about nutrition was carb loading. I
Yeah,
mean, and that included pizza.
yeah,
And so a long run on Saturday of 20 miles, I'm there Friday afternoon at all you can eat Pizza Hut. And then of course the dessert pizza, I knew that wasn't right, but I'm going to run 20 miles, so I'm going to have that too.
yeah. Gotcha. And that was defining your kind of running. That time frame of running as you were eating what you would consider a very high carbohydrate, high sugar
Absolutely,
type of diet. Okay.
absolutely, absolutely. But aside from those few days before a long run, I was eating, the standard American diet. Yeah.
Okay. Gotcha. And another question I had, if I go back to, let's say, that 2015, 2016 time,
Mm.
even if it was just on accident, was there anything that you knew about nutrition that you would still consider accurate today? Or was it just like, I really just didn't know really
Yeah.
anything
Oh
correct?
no, I knew sugar was bad. I knew that, but I didn't know it's even bad during marathons. And that's what those gels, I would suck those down every 30, 40 minutes because that's what the package says. And yeah, so I knew sugar was bad back then for sure. And ice cream's not that great for you, but I did not know, and it's so annoying every time I go through a grocery store, although I don't go in the middle anymore, is Cheerios, heart healthy. Even honey nut Cheerios are still heart healthy. And so, part of me had to know that was wrong, but it's right there and I'm running, so I'm eating these like crazy. And
You're
that was my first actual home test. Was I got glucometer after she told me I was pre-diabetic. I checked it before breakfast, 96. I checked it an hour after, Cheerios, skim milk, blueberries, coffee, half and half, 96, 165. An hour later, that blew my mind. I do it. This is wrong. I'm gonna do it the next day. Okay, 96, 170. Okay, it wasn't wrong. So the third day, never had cereal since. Third day, 96, 98. And what I ate was 3 eggs, cheese, 3 pieces of bacon, coffee, half and half. And I've had that for 8 years now for breakfast.
Sounds pretty good to me, man. I like that. Won't even miss the cereal. Yeah, that's amazing. Another moment I wanted to go back to. Oh, and just thinking back, remember doing those marathons and having to eat all the sugar and carbohydrates to even just top you off for fuel so you didn't bonk.
Yeah,
Do you
yeah,
remember?
yeah.
Do you remember those stomach aches that you would get and how
Oh,
terrible that would
sure.
feel?
I remember throwing up at the end of one.
Oh,
But that actually was because I always drank water during them, and I accidentally started in Marine Corps Marathon. I just picked the cup and it was Gatorade. And then I was about mile 20. And then I thought, well, I guess I have to stay with Gatorade from here to mile 26.
oh,
But
so
yeah.
syrupy sweet, especially now once your taste buds change. I could not handle that.
But I'm glad you asked about that because I want to mention this. I ran 2 marathons keto and ran them without breakfast and ran them without calories and just electrolytes. And I was older, so my times weren't really any better. I wasn't training that hard at that point because I was better. I didn't feel like training as hard. But what did not happen was the bonk. Mile 20, 23. Oh, it's real. Have you ever done a marathon?
I haven't done a marathon. No, I've coached people through them, both
Yeah.
on the traditional diet and on a ketogenic or carnivore diet, all the way up to like the Ironman level. So
Yeah.
doing a marathon, but only after riding the bike for 112 miles and swimming for 2.4 miles. So yeah, I get it.
Yeah, so the bonk was there every time, just severity varied. But those last 2 marathons that I did while eating keto and not having breakfast, no, it was just even throughout the
Yeah.
race. Sure, I was more tired at the end, but it wasn't like I'm laying down right now.
Yeah. Yeah, no, I get it, man. It's awesome. That's the whole reason we're having this conversation is I found out some work about a coach who was training endurance athletes and feeding them fat. And we were using metabolic carts to measure all that stuff. And yeah, when we switched people's diets over, their fat burn would increase, their sugar burn would decrease, and bonking was now a non-issue because you're just using energy that's already on the body. And even now, like teams in the Tour de France will go through tons and tons and tons of exogenous ketones in their bottles because they know, how powerful an energy source that is. So I find that all very interesting. So thank you for sharing that. Another moment I wanted to go to is the moment of diagnosis. Now, you were told that you were pre-diabetic. To me, you kind of didn't really have much hesitation to say that you knew immediately she was wrong. Is that like in hindsight, or did you really,
I
you
know.
really knew
She
in that
didn't.
moment?
No, she didn't take much of a history, and so she said you need to exercise more. I was running marathons. I mean, are you telling me I got to do 2, Ironmans? Is that I won't have diabetes if I do Ironmans? So I just knew what that's at that second that more exercise couldn't be right. The fat part I didn't know. I wasn't sure, and that's probably why I did vegan diet. Well, no, I know why I did vegan diet because then I walked in a bookstore and first book I found was How Not to Die by Dr. Greger.
I remember that one.
I
I got
obsessed
sucked
on
into that
his
one too.
work. His videos are slick and they convinced me. And
Yeah.
and you can do a vegan keto. You can. I know people that do. You can do vegetarian keto. But I was doing a bad version of a vegan, and just a lot of chewing. I give props to anybody that can digest that much food because you got to eat a lot.
It's a lot. Yeah, no, it's a lot. Yeah, so I had already read The Big Fat Surprise by 2016, but when I got certified as a nutrition coach in 2017, it kind of re-indoctrinated me into some of that kind of stuff. And I remember getting that audiobook sometime around there, late 2016, early 2007, or 17, around the time that you saw it. And it's very convincing. The arguments he makes in that book are all extremely convincing. And I had the same issue. Like I was working in a staff of a lot of nutrition coaches, personal trainers, people that cared about their health and fitness. And not only was I not really able to do it, it's like you said, like, can it be done? It can be done. You can do it
Yeah.
keto. It's
Oh,
very
yeah.
difficult. And
Yeah.
my observation was, can it be done? If it is, it's extremely difficult, and not many people around me, including myself, are able to do this and stick with this.
Yeah.
Because you're
Yeah.
right, it's just the one statement you said, like to eat that much food, to prepare that much food, to go out and buy all of this food and throw half of it away at the end of the week is
Yeah.
it's
Yeah.
insane.
Yeah. It's not efficient.
Yeah. How long did you last on that diet?
It's about 6 months.
Okay, pretty good. That's
Yeah.
pretty
Well,
good.
I had gotten better. My brain was better. I was still on one antidepressant. And so I just needed to keep going down the right track. But then what really turned it was walking back in Barnes and Noble, walked through Psychology Today because I was still on antidepressants. I always thumbed through that. And it has to be a miracle that I saw Dr. Eads saying she was going to the ISNPR conference in Bethesda, Maryland in 2017 about diet and depression. And I was like, really? Because at that point, I was just wanting to keep the weight off. I'd lost some weight because I'd lost appetite, and I wasn't really thinking it was ever going to fix my mood. And so I'm fine. I just want to keep the weight off. And so I'm looking at books, and then and there it is. And so that was a meeting. It was a meeting of International Society for Nutrition Research in Psychiatry. And I'm an optometrist, like you mentioned. I wasn't even sure they'd let me go. But I had gotten my courage up and I was just like, well, she says diet might do it. And so I just signed up, went, and Dr. Eid was amazing. She talked to me the whole meeting. I sat with her listening to Dr. Palmer's lecture, and that was it. It was a done deal. I was going to eat animal-based keto, or at least keto, and this worked.
I didn't know that, Eric. That's super cool that you were actually in the
Mm,
room with them, that you were able to find
mm.
Psychology Today as a magazine. Is that correct?
Sure. Yep. Yeah. No.
Wow.
And I've since talked to Dr. Palmer. That was his first public presentation on this. Prior to that, he had been using keto in milder cases of depression and seeing good results, but he was keeping it under the radar. And then when his first schizophrenic patient stopped hearing voices and started saying, I think I might have schizophrenia and it's getting better. That's
Wow.
when Dr. Baum said, I can't I have to be public
Wow.
about it.
This is so when you and I go to conferences and we hear these people present, like by and large, these people, you're kind of preaching to the choir essentially. Like we're here because of this. Even if it's early in our journey, most of us are bought in. You wouldn't
Yeah.
travel to
Yeah.
Vegas and not do Las Vegas
Yeah.
things, or travel to San Diego and not do San Diego things,
Yeah.
and sit in a
Yeah.
dark conference room
Yeah.
unless you were
Yeah.
somewhat bought into this. But
Yeah.
I'm always curious when these people go out and do these conferences to the general kind of
Mm.
public, especially thinking back then, like 8 years ago, that was Chris Palmer's first presentation. That
Yeah.
would have been completely new information. Do you
Yeah.
recall what it was like? Obviously, you were bought in, but like, do you recall
Well,
what
he
what
said,
the vibe?
and I was so nervous at that, but I recall after the meeting, I recall he was in the hallway and everybody was crowded around him asking questions, and I just said, I'm going to wait my turn, and I'm going to go. I don't even remember what I asked him now, but people were very interested, very interested. But
They were.
that's the highest level of scientists in psychiatry at this point, and so they're a little more open.
Well, that's good. Again, we opened this conversation by you having the 3% of doctors know about
Mm,
insulin
mm,
resistance. And so
mm,
you always
mm.
wonder, is there a lot of interest or is there not a lot of interest, or do they think it's clapper?
Now ask me how interested are any of my current or former doctors.
That's a great question. Let's go there.
It's sad. It's just so sad.
That's too bad.
Part of me understands because I'm an optometrist and I prescribe glasses. So if someone came to me now, I'm 65, and said, you know what, you've measured bifocals wrong, really the whole time. You've gotten some right, but you've probably gotten half of them wrong. I just probably would say, "Oh, that's interesting," and I would not listen to anything else they said. And so
Mm.
I kind of get it, but no, my former doctors are well, they do one just says, "I'm happy you're better." That's the level of interest. And okay, my cardiologist, we haven't gone down that road yet. I literally hand him the book, Dr. Reed's book. My story's in here. I tell you, my story is on page 157, wherever. And here you go. This is why I eat the way I do. he's picking the book. He says, "Is this for me?"
Wow.
Yeah.
Well,
So that's the level of interest.
interesting. Yeah, well, it's a shame that it's not more than that for sure.
Yeah.
But I also I just kind of pondered the difference between somebody like you who, saw the signpost, found it. Maybe it was a blessing that you were able to flip
Mm.
open a random magazine on that random day at a Barnes and Noble, but you still, like you said, worked up the courage and you made it
Yeah.
there, and you
Yeah.
decided to do something really unconventional. You'd already been down
Yeah.
the vegetarian vegan route, and now you're learning that all of these things that we said have been good for us for so or bad for us for
Mhm.
so long actually might be the best things. And you were like, you got it. You were bought in. What was the transition process like for you? Because again, back then there were far less resources than there are now. If somebody wants to try a ketogenic or
Well,
animal-based diet,
yeah. Yeah.
what were the challenges you remember?
Well, the big fat surprise, obviously, Nina Teichol's book was just that sealed the safety of an animal-based diet for me, and it sealed that the low-fat dogma was wrong, and it's at least it's wrong for someone who's diabetic. And I just finished Gary Taubes, or almost finished Gary Taubes' book, Rethinking Diabetes,
So
and
good.
it's an amazing book, and it shows why the low fat is still the promoted diet. So how did I overcome it? Well, I just, it goes back to people often say, what's your why? Why are you doing this? Well, I was doing it because I didn't want to feel horrible. I found a way that made me feel better than I've ever felt. And so why would I ever do anything different? Other than, back to the heart things. We'll get around to that in a minute.
Yeah, love to.
That was my
Love to.
fear. Okay, that was my fear because my cholesterol might go up.
Yeah, got it. Okay. Um, yeah, again, I find it amazing that you were able to embrace that. Do you remember, what things started to get better immediately? You said you changed the diet and everything started to
Oh,
feel better.
very interesting question because I was still on an antidepressant, fairly high dose, and when you're keto and on antidepressants, you can have side effects from the combination, and those side effects could be a little bit of mania. And I definitely had a moment of just, well, not say a moment, months of not getting enough sleep. But I was like, I'm fine. I don't need any sleep like that. I'm got all this energy. I'm just going to keep going. But looking backwards, talking with experts, that was a little bit of hypomania, which once I tapered off the antidepressant, that went away. And so the transition, I was scared to death to come off that medicine because it was Effexor, and that's one of the ones that has some of the worst withdrawal effects from what I now know. So I was scared to death. Brain zaps, all these things, and so I just kept tapering it down on my own. I was on my own. I'd quit going to the psychiatrist at that point because I was getting better, and he wasn't watching the transition I was going through. And but I got lucky, and so maybe that transition off of medicine and that year of getting better, fully better, was I could have gone off a little quicker, but it's so individual. And so I want to just say to people out there, absolutely do not change your medicines without telling your doctor what he's doing. He doesn't have to agree with what you're doing. What you're doing is changing what you eat. You don't need a doctor to sign off on that. Doctor, I'm going to quit eating cereal. I'm going to have eggs every day. Do you agree with? No, you don't have to do that. Change your diet, but do tell him, and he won't know that this is going to have such a radical effect on your whole metabolism, including your brain. But say, hey, this might make my medicines too powerful. You need to be watching out for that in me as we move forward.
Yeah, well said. And it is interesting. And of course, we would always 100% say the same thing, that work with your doctor, especially if you can find somebody who's familiar with the diet so they can take you down, in a good way. But there are people like you, Christina and Genevieve, like there's a lot of people out there that ended up getting off of them on their own, and they may have had their moments, but they were able to get off. So again, work with a healthcare professional for sure. It's just interesting to hear the stories like yours of people that didn't necessarily do that, but still got through okay. And we've been dancing around insulin resistance. It's one of my favorite questions to ask everybody because everybody's got just a little bit slightly different flavor of how to explain it. But for you, understanding insulin resistance, how would you explain it to somebody if you were, trapped in an elevator with somebody and they just asked you randomly? How would you tell them insulin resistance works?
Well, yeah, your body has to get fuel out of your bloodstream, and most of that fuel is glucose that you ate, because most people are on a high carb diet. And to get that out of your bloodstream, it uses the hormone insulin. And for most of your life, that's going along just fine. But if you overconsume carbohydrates, you've taxed the system to where insulin levels have been running so high, cells start to ignore the signal, but not all cells apparently. So some cells pay attention even when it's high, but they start ignoring the signal, and then your blood glucose goes high and you're diagnosed with type 2 diabetes. But wait a minute, that process takes 12 years more, maybe 15. There's a graph that I love. I think it was from Reven that said, if you watch over time, your triglycerides, your weight, your glucose level, and your insulin level, fasting insulin, which nobody's checking. But if you watch those over time, you could pick early insulin resistance 10 years before your blood sugar is out of control. 10 years later, that is when your doctor is telling you have a problem. So yeah, anybody, you can order your own tests on your labs, Dave Feldman, and you can get a fasting insulin, fasting glucose, figure out your HOMA-IR, and now you know more than your physician.
Yeah, seriously.
And show him, hey, look, I'm insulin resistant. Of course, he's probably even endocrinologists are probably just going to tell you to eat less and exercise more. Eat less of what causes your insulin to go up. That's carbs. That's bread, pasta, rice, liquids, the worst. Sugar.
Yeah. And the ironic thing is a lot of the doctors are probably insulin resistant themselves. No judging, but that's just the reality.
It's a fact. And it's just so disheartening to talk to that recent med school graduate, and he's say it's 3% of PCPs, 3 to 5% understand insulin resistance. And I just, I don't know.
Yeah, that's wild. Okay, so you're still practicing as a doctor in ophthalmology, and somebody might say, okay, insulin resistance, that doesn't really sound like something that would affect the eyes. But you're seeing all this amazing transformation in yourself. How does this kind of work slowly end up trickling down into your practice? Was it something you were talking about? And the other side of that coin is, how does insulin resistance impact the eyes?
Yeah, so I'm an optometrist. I don't do surgery. Ophthalmology does surgery. I do eye exams. Optometrists do most of the routine eye exams, and then we treat eye diseases like glaucoma. If you need surgery, then you go to an ophthalmologist. Okay, so we'll get that clear. Well, over the course of my career, I've seen my patients gain weight, and then I see the medicines people are on, and I've seen everybody get put on diabetes medicines, and then I see people getting put on mood medicines. And it's just obviously way too frequent. And then I have the occasional patient come in where I take a picture of the back of the eye, look at the blood vessels, and I say, you know what, I think you've got diabetes. I know that you haven't been told that yet, but you need to go to your doctor and be tested. And the one that really comes to mind is someone I knew well, and A1C was 13. And so that's dangerously diabetic. And vision 2020, seeing
Oh, wow.
fine. Yeah, exactly. So diabetes can affect vision, and it can affect vision acutely, and that's in your vision will seem clear parts of the day and blurry other parts of the day, and that's your blood sugar going up and down. That's not as common as I once thought it was. So it's more looking at the back of the eye and looking for leaky blood vessels, which it's amazing how bad that can look, and people still see 20/20. So yes, going to an eye doctor is a screening for both high blood pressure. They show changes in the back of the eye, and diabetes.
Is
So
that
yeah.
common knowledge in ophthalmology?
Oh, sure. Yeah,
That
absolutely.
is.
Yeah, but it's all diabetes. It's not insulin resistant.
Got
Uh,
it.
yeah.
Yeah.
And but then I go the next step. I did, 7 years ago when I first started learning and understanding all this. I go the next step and I would ask people, what did you're diabetic, what did they tell you to do? I'm just curious and I'll eat 6 meals a day. And then I just sighed and then, okay, well, give me breakfast. What they tell you to have for breakfast? Cheerios and skim milk. And but I sat there with this much older patient who told me that, and he said, I don't think that's right. And I just laughed. I said, okay, you're getting you're going down the right road there. So yeah, so it's just trying to tell patients, here's a way to improve your health. I think and so just change what you eat. And like I say, you don't need a doctor to approve on it. You just change what you eat. And I'm very fortunate to have Dr. Westman 20 miles from me, and occasionally I can have a patient agree, if you really want to see the world expert, he's 20 minutes away, and
Yeah.
and
Wow.
6 month wait, but you can get in to see him.
It's an amazing resource for sure.
Yeah.
And it would be interesting. I could see how, on the one hand, um, I would think, okay, this is my ophthalmologist. This is not my
Mhm.
endocrinologist. Whatever this guy's saying, it's obviously not his area of expertise. I could see that for sure, and see people just say like, yeah, no, no thanks.
Absolutely.
I want to go get this from
Absolutely.
my general doctor endocrinologist. I could also see that what you just described, where it's like, okay, they told me to do this. That doesn't make a lot of sense to me.
Mm.
And now somebody else in a different
Yeah.
field is confirming what I already thought. That, like, if I'm worried about blood sugar, why am I eating things that have sugar in it? Like, you do see that kind of confusion. Well,
Yeah,
generally
absolutely.
speaking, what has been the reception as you've been kind of talking to people over the years?
Well, and I love that question because I'll go through, I'll go through everything, and usually they'll just sit there, and by a wide margin, first thing they say is, "But I love bread." It's remarkable. That is the first thing they'll say.
Wow.
But now I like having Metabolic Mind website up there, because a lot of times I'll tell patients, you know what, it fixed my depression also. And then I'll just pull up the website and then my picture scrolls. I say, oh, who's that down there? I'll say, that's you. And so I think people that see that are like, whoa, okay, maybe he does know something,
Mm.
because there's some validation by a third party, shall we say.
Yeah, that's amazing. Well, and it's so cool to contemplate that this diet can help with so many different things. So whether you want to get at it for mental health, whether you want to
Mm,
get at it for weight loss, whether you want to get at it for digestive health or endurance athletes, all the things that
yeah.
we've talked about before, there's so many, things that improve and ways you can get somebody
Pain.
pain.
I just listen. I don't know if you've heard Dr. Westman on Dave's podcast. Fabulous episode. Everybody has to listen to Dave Feldman, the Feldman Protocol podcast. And one of the conferences Dr. Westman was invited to was a pain specialist conference because they understood keto can help people in pain. That's remarkable. I'd not heard that story before. That's remarkable. And people on opiates, we need more levers to pull to reduce their pain. One of the ways is keto. And he said, doctors were coming up to him saying, yeah, we know this works. What about the cholesterol?
Yeah, that's awesome. Maybe we can go there next. I can't recommend Dave's podcast enough. Um, yeah, he's done an amazing job in just starting that podcast. And yeah, let's talk about the cholesterol thing. That is a big issue. That even got Dave Feldman into this world. Most people would probably know his story, but just to briefly kind of review, as a data engineer, he finds a ketogenic diet. It improves everything. He feels amazing. All of his blood markers get better except for one, which is his bad cholesterol. And so a little bit freaky when you're doing something that you think is really good for you and you feel amazing, and then your doctor is saying like, you're a heart attack risk. And surely, of course you are. You'd have to listen to that. And so, that is one thing to be concerned about. And you coming into this space with already having had, some level of a CAC score and, cholesterol meds. What were your reservations about going on a diet like this as far as cholesterol goes?
Yeah, well, it's complicated. But and it took years, I was still on Lipitor, but once I understood uh, lean mass hyperresponder is normal physiology in a healthy person, as far as we know right now, then I realized that's just my body reacting in a natural way to the way I'm eating. But having atherosclerosis, you're still concerned. And so I did try to take a statin while keto, but it gave me two side effects: calf pain and also cognitive. Those 10 years I was depressed, I'm not going to say, well, I'll just say that I don't think Lipitor helped. So actually during that depression period, that was one of the things the psychiatrist said. He said, "Why don't you stop taking that?" That just blew my mind. I'm like, really? I can do that? And so I did. That didn't really help then. So, yeah, concern with LDL. I mean, it's real, and but now we're watching Dave's studies show that it's complicated. Some people are going to show progression, rapid progression. Some are going to most will stay the same. Some will get better. But a bigger picture, back up, if you're overweight and you're in pre-diabetics, when I first started this, my cholesterol didn't go way up. It didn't go way up until I normalized my weight. And then it went to very high levels. And so for now, I take Zetia and a baby aspirin. Zetia halves my LDL. It goes from off of Zetia, it's 196. On Zetia, it's 95.
Wow.
I know. So, but is that helping or is that hurting me?
It's a great
No,
question.
no one knows.
Yeah.
And the smartest people I talk to say, well, the odds are it might help. It's going
Got it.
to do less harm than it might do good.
Yeah, got it. Okay. And now before we go any further with that, can you tell? So you did fit the criteria of a lean mass hyperresponder.
Yeah, yeah. Well,
Okay.
I mean, I guess technically, I think 196 was the highest I got on LDL, but 200 is the criteria. That was 196, triglycerides 67, HDL 81. So I was 4 points away from being, and if I,
Close enough.
checked it a few times, yeah, I was right there.
Yeah, close enough. So very low triglycerides, really high HDL cholesterol,
Yeah,
and then LDL cholesterol that is, double, maybe
yeah,
triple, quadruple
yeah,
what most doctors would be comfortable with.
yeah. And so all those years I was on statin, my LDL was fine. It was
Yeah,
under 100, and
interesting.
but my triglycerides were doing that. And,
Drifting up.
and all the doctor would say is, lose 10 pounds. That was
Interesting.
literally written on the lab reports.
Interesting. And I just made a note too. If I remember where I found this, I'll post this in the show notes as well. There's a video, something along the lines of statins made me stupid. And it was just this guy who was prescribed, I want to say, I don't know what it was and how much it was, but it was kind of like a moderate dose of statins. And like, I remember him saying, like, I used to play card games with my family every Wednesday night. And now I can't even like bring myself
Yeah,
to play this game that I can't get the numbers straight in my
yeah,
head.
yeah.
Do you remember like kind of fogginess symptoms that are similar to
Yeah,
that?
I think that's a very complex subject. So, but for me, for what I experienced when I went back on them, was more a bit not fogginess, but it was more anxiety and a little bit of what if thinking. Like I'd get in the car to go out. Did I turn the stove off? I'm not certain.
Got it.
I'd stopped doing that completely. And maybe 8 months on a statin after being keto, I'll just go look. And then as I was doing that one day, I'm like, wow, this is weird. I haven't done this in 5 years or something. And so, and the mood maybe dropped a little bit, not so much fogginess. So yeah, I just said, okay, that's it. I can't do statins, and that all went away and cleared up. And
Gotcha.
and now I can do, but the catch 22 or whatever it is, I feel statins have a lot of pleiotropic effects, and a lot of their benefits come from non-LDL lowering effects,
Good point.
not from lowering the LDL. Zetia, on the other hand, maybe doesn't have all those other nice benefits that statin has. The bad side, but the good side is it actually lowers heart attacks for reasons other than LDL.
Got
So
it. Yeah, thanks for dropping that in there. I appreciate that. And you were featured in Dave's movie, which is wonderful, and hopefully, that will be released in the next year or so. It sounds like it's on track to be released somewhere. Really well done. Included, our mutual friend Robin, and her incredible story, and you were featured in there as well. I'm so glad they decided to do this, because I think a lot of people, especially in the Twitter sphere, think that what Dave is trying to promote is that LDL is not the cause of heart disease, and nobody should have any concern with very high levels of LDL cholesterol. And, people like Robin are affected directly. She got into this space because she did not want to take a statin, and she chooses to live her life free of bipolar medication, and run the risk of having an LDL cholesterol that's very, very high when she eats the proper diet, which for her is a very low to almost no carbohydrate diet. She takes that risk. She understands what that
yeah,
is,
yeah.
and takes that deck of cards. And for you were included, and it was all to say, like, I'm choosing to take a small dose of something else that I think might happen, because I think for me it's hedging my bets. I don't notice side
Exactly.
effects. I feel really good. Tell us about that decision and what that's like to, live with that decision.
Well, like I say, people smarter than me think it's a good idea, and I have no side effects like I did with the statin. I have noticed no known side effects. So yeah, I do think it's hedging my bets. Zetia is most effective in lean mass hyperresponders. It's only mildly effective in people eating a standard American diet, and so that's why it's not prescribed that much. Um, so yeah, it's pretty easy one. My family now knows. Well, he's not just running around with cholesterol through the roof, thinking he's impervious. And so that's a reason I do it too, because they're like, well, he's doing everything he can do.
I,
Something eventually happens to all of us, and
right.
and it could be blamed on high cholesterol or low cholesterol.
That's right. Yeah, no, I love that perspective. I'm so glad they included that in the movie, and that you
Yeah,
were
yeah,
willing
yeah.
to share that. Did you get any pushback from people in the low carbohydrate
Yeah,
space
good
who think
question.
that,
Well, not and the movie hasn't been widely seen yet, so that will be interesting to see. I put it out there on Twitter or X frequently, and I don't get well. I get a little pushback on Twitter when I say I take something low on my LDL, but yeah,
yeah, got it. As far as the studies are going, obviously this year, we had some follow-up data that came through the lean mass hyperresponder cohort study, and there was a bit of controversy, obviously, with some of the quantitative data that came out versus the semi-quantitative data that came out, and we now have three different, individual kind of independent companies that have looked at some of the quantitative data when they use AI as a technology to assess different scores. The first one that came out and was reported on was not so favorable, and took a lot of flack. And I know this is something that you've been kind of interested in. How do you see all of this as how it's unfolding, and what story do you think has been told so far?
yeah. Well, it was unfortunate that the total plaque score was the very first information out there, and that's expert readers looking at the plaque in a picture or an image, and that was favorable. And that's really what the first version of the movie was based on, just total plaque score. And then the second set of data came out, and it was just confusing because it didn't agree with the first assessment, and then it was like, well, we just have to step back and do more. And we being the study team, I'm just watching all this from afar. Somewhere in April, we got to hold our horses. We got to look at other analyses and make a bigger conclusion. So we're still waiting on that paper. Still waiting, but Dave did have a presentation which you were at and I was not, where he goes over the other two, heart flow and Q angio, and they align with the first one, total plaque score. So now the only one stands out on its own being aberrant, and it's clearly, and it just is confusing. But even within, it's my understanding, within Q angio and heart, some progressed a fair bit. Most stayed the same, some got better. The difference with clearly was everybody got worse, and
Yeah.
that just didn't quite make sense.
Yeah.
So
It's
I'm
unfortunate.
waiting. Yeah, I was totally unfortunate, and I was beside myself with the difficulty they went through.
Yeah.
But I think we're on the other side of that now.
I think so too. I think when you look at the data as a whole, it's just so much more consistent than that first clearly report was.
Mhm.
Nobody even knew that they were going to be using that. I didn't know. Maybe other people, maybe you knew. I didn't know they were using
No,
any other form of data collection in to
no,
begin with, and that it was so it just didn't make any sense that it would be so astoundingly
yeah,
negative when these people had been on the diet for so long, and then all of a sudden this 1 year, 5, 6 years in to eating this way, all of a sudden it's
yeah,
jumping that big.
yeah,
It didn't add up at
yeah,
all.
yeah, yeah. It's so, and that, and now, and understanding that is so complicated. We just pretty much have to wait for that next paper to come out to fully understand it. But to get an overview of everything as it is now, we've got three things that align, and they're what we said. Some people progressed, most stayed the same, some got better.
Yeah. Yeah, no, I get it. If I were a detractor, I would just look at, what's going on and just say, oh, these guys are just shopping around and
Oh,
finding
absolutely.
methods to try to tell the
That-
story they want to tell. But that's, it's not actually what's going on. And
yeah.
this is important because, people like you can make decisions based
Mm,
on this kind of thing. If some people are
yeah,
progressing, other people are not progressing, well,
yeah,
maybe it is worth it to take
yeah.
a small amount
No,
of
if
medication because you're seeing that
sure,
play out.
sure. If all the data we ever had was the clearly data, I would be more concerned.
Right. Yeah, for sure. Well, it's nice that they're pushing through, and like you mentioned, I agree with you too. It seems like we're on the other side of that, and people are moving on to whatever the latest thing that
The
everybody's
fear
getting.
is now, the fear I have now is all the pushback that happened between April and October. And now, okay, well, now look at this new stuff, and it's just literally nothing. The critics are just like, they're not there. They've gone quiet.
Interesting.
And yeah, very interesting. And we'll see if that changes once the paper's actually published. I have my doubts because they're not going to like the new data.
Yeah, good point. Well, yeah, I was able to watch that presentation. I know you were able to watch it virtually as well, and it is looking a lot better and does align a lot more with what we would expect with somebody like that. So again, I really appreciated that they shared your story as part of that documentary and
Yeah,
didn't try to
yeah,
tell the story of like all of us are
yeah,
completely
yeah. We're
irresponsibly
all
just,
bulletproof. We're
yeah,
all cavalier. We're all running around like, none of it
yeah.
matters.
I love it. Yeah. I just have to ask, career-wise, you said you're 65, you're coming up on possibly retirement. Like, what's your plan? Do you think you'll be
Yeah,
retired anytime soon or still working?
I work 4 days a week now, and I could see doing 3 days. But dang it, this metabolic discovery I've got has me very interested in seeing patients again. Not that I wasn't interested before, but I just like when I see somebody, boy, I bet you this could help them because I see the medicines are on. I love telling my story there, and that's a draw for me to keep working, really.
I love it. If you're listening and not watching, you just missed Eric's face just completely light up with a smile as he talked about practicing. I asked you the question because I don't think I would have been surprised with that answer. I can tell you're very passionate about this message. And of course, you practiced really well for years and years and years and did what you were doing. But I know what it's like to be working in an industry where you're telling people to do something and it's like 100% of people can't execute what you're doing. You just think that everybody's a failure and you find something completely different. And it's
Oh,
so much
and
joy.
I want to hear your transformation with this. I'm sure you have a podcast where you've gone through all of this. You need to send me, but link them in the show notes.
I will for sure. It's just, yeah, you're told, all your clients need to eat the whole grains. They need to train a certain way. They need to have all these complicated workouts and plan all their meals and get all the greens and all this stuff. And again, all you're doing is like behavior coaching people into oblivion. You can keep them on your payroll because they're never going to be able
Yeah.
to do what you're doing. And so you coach them perpetually. where it's like, okay, we start doing the opposite and everybody's getting great results and they're
And so,
happy.
so
It's
what, how
awesome.
long did you do the former and how long have you been doing the latter?
I'm a slow learner, my friend.
Well,
I'm
please, we
really
all are.
slow to get on the bus. It was I had been a personal trainer. I'd been involved with gyms, all through my teens, and been around personal training. But I'd been a personal trainer since 2007. Like I said, I got certified as a
Yes.
nutrition coach in
So 10
17.
years, 10 years of traditional
10 or
advice.
11 years of that, and then our first weight loss contest when somebody said, hey, I just did keto and lost a bunch of weight, what is this? And that was the rabbit hole in
Oh no, wait a
2018.
minute, wait a minute, wait a minute. So a client of yours told you that.
Yeah, participant in a
That's
weight loss
so
contest. It was great.
fascinating. Because
Yeah,
do you know Dr. Westman's story?
yeah, of course. Yeah,
Yeah, the patient,
yeah.
two patients, and it didn't. I don't know if it took two with you, but with him, it took two patients coming to him saying, "I've lost 50 pounds. How'd you do it?" First one, I said Atkins, and he said, "Well, that's crazy." And then the second one said Atkins. He said, "Well, I better study this." So
Better
was it
check it
just
out.
one patient for you? Or
Yeah, and I mean, it was 2018, and so at least the word was being
yeah,
tossed around
yeah,
a little bit, and I'd already
yeah,
heard the Joe Rogan with Sean Baker on it, and so
yeah.
it
Still,
was easier to wrap my head around. But yeah,
yeah, still. So you were somewhat open to it, but interesting. But
it
did
was
you
nice.
have much transformation to make, or were you already healthy? I mean, you
For
did
me
you.
personally, I was fairly healthy, but yeah, like having to, if I'm going on a 3 hour bike ride and I don't even need to bring a
Yeah,
water bottle all of a
convenience. I
sudden.
get
Yeah.
it.
Yeah. You
Yeah,
just feel so much better. Yeah. I don't need
yeah,
granola bars between clients and, your
yeah.
thinking is more clearly. It was, I
Food
definitely had the
noise. You
transformation.
have less food noise.
Food noise way down, anxiety way down, especially when
Mm.
I transitioned over to carnivore about 6.5 years ago. Just the anxiety I didn't think I had. And it's just
Yeah,
such a wonderful way of living. And like we just said earlier, like so many things improve, you can't unsee it. And, if it makes you excited to stay in your career after it's retirement age, you still want to see
yeah.
people. I
Well,
think
there
that
you
says a
go.
lot.
Exactly, exactly.
Yeah, I
Yeah.
love it, man. Well, I'm so glad we got to chat. This has been an amazing conversation. I'm really grateful for you, and your journey, and that you'd be able to be, willing to share it with others. Not only in your practice, but also on our show and on the movie that
Yeah,
Dave's making. And
absolutely.
it's been a wonderful conversation. Where can people go to find you and connect with you and your work?
Yeah, on Twitter or X, I'm at Dr. Eric Rodgers, Rodgers, and I'm very active there. So please, yeah, reach out to me there.
You're very active there. We will be sure to link that in the show notes. Does Twitter ever just drive you absolutely crazy?
It's a very long journey. I've gotten better.
Okay, good.
But there were points where friends were like, "Hey, Eric, you need to stop here for this weekend.
That's
Stop."
funny. Yeah, that's funny. Well, you're very good on Twitter. You're very friendly with everybody, and I really appreciate that you get the information out there in some way. So thank you so very much, Dr.
All
Eric
right.
Rodgers. This has been an amazing conversation. And like we said earlier, we're so grateful for you and your journey. So thank you for everything you've gone through, and thank you for taking time to be on our show today. We really appreciate you.
All right. Thank you.
Absolutely. And this has been another episode of Balanced Body Radio.